Hello, Dr. Hotez, and hello,
Hello,
everyone.
how are you?
Good. Thank you all for joining us for this HoodMed Chat, a special Let's Get Vaccinated HoodMed Chats crossover episode featuring Dr. Peter Hotez, who is going to give us a quick Omicron update, and we're going to get into a little bit about how its emergence relates to the need for global cooperation and equitable vaccine distribution. My name is Dr. Nisi Hudson, Chair and Science Director of Hood Medicine Initiative.
I'm Jonathan White, co-founder and director of policy and engagement.
And my name is Douglas Slaughter. I'm the public health director.
Hood Medicine Initiative is a collective of scientists, physicians, hackers, and assorted geeks focused on addressing health disparities in Black and brown communities and reducing the spread of disinformation.
HoodMed Chats, our signature event, is an effort to bring the expertise of healthcare professionals and others into those communities. Our goal is very simple: help us, save us. Today, we are extremely honored to welcome back our VIP, Peter J. Hotez, MD, PhD, a professor of pediatrics and molecular virology and microbiology, and the founding dean of the National School of Tropical Medicine at Baylor College of Medicine, where he's also the co-director of the Texas Children's Center for Vaccine Development. Welcome back, Dr. Hotez.
Oh, thanks for having me back. It's good to see everybody.
Definitely.
Yeah, so I know we don't have you for long, so we're just going to jump in. I don't know if you're starting to feel a little deja vu as well. I think a lot of us would love to go on like a I told you so Omicron world tour, but we would like to start you off by giving us your perspective on like the lessons we refuse to learn in this pandemic.
Well, I think, first of all, where we're at with Omicron, I don't have to tell you, it's so incredibly transmissible. The numbers are just rising very quickly. And the thing that I'm worried about is it knocking out the healthcare workforce. Not that they're getting very sick, the healthcare workforce, but at home because of breakthrough Omicron. And that's a dangerous situation because there's a lot of happy talk about Omicron, but hospitalizations are rising. We don't know if that's because of Omicron or some kind of hybrid of Omicron and Delta. A lot of the healthcare workforce is staying at home because they're sick with breakthrough COVID. And that 1-2 punch is pretty dangerous because we've seen when hospitals get overwhelmed, ICUs get overwhelmed, that's when the mortality rate climbs. And I think that's the situation we risk right now. Lots of transmission, even though the individual severity of Omicron is on a general basis is less, it's still severe enough. Unvaccinated people going to hospitals and ICUs, not enough healthcare providers to take care of them because they've been knocked out of the workforce with breakthrough COVID. We're seeing, 20, 30, 40% of nursing staff, hospital staff, docs unable to come to work. And then, two of our 3 monoclonal antibodies don't work against this variant. Only the one from GSK, Vir, seems to work. We don't have Paxlovid, the Pfizer drug yet. We do have remdesivir. And of course, nobody can get a diagnostic test, or for everyone who's willing to wait 3 hours to stand around a block or to go up to a drive-through, there's probably 5 or 6 people looking at that line and saying, heck with that, and walking away. So this all creates, I think, a pretty serious situation. So I am worried about how the country operates over the next few weeks. This wave we're seeing now coming from the mid-Atlantic states, Washington, D.C., Maryland, Virginia, and then up into New York, going west into Ohio, Indiana, Illinois. Eventually that will consume the whole country with Omicron. And what Mike Osterholm calls a virus blizzard, I call a virus storm, same idea. And then the schools want to open, and nobody wants to delay the opening of schools. So, and now we're seeing a lot of kids get sick, and a lot of pediatric hospitalizations. So, in the meantime, you turn on a lot of the cable news networks and talking to my colleagues, and you're hearing a lot of happy talk, and I think that's not helpful either. So I do think things will get better in 2022. We are vaccinating more people, and maybe with our vaccine, we can talk about, we'll vaccinate the world as well. But in the meantime, I think the next couple of months could be a very tough time.
So could you? This also relates to a question from one of the listeners, Ben Lee. He's concerned about being able to keep up with all the COVID mutations and the differences in what one should do. So he wanted to know what's new with this variant that the public should really be cognizant of, and outside of the measures that are in place, is there something more that we could be doing to make ourselves safe?
Yeah, I mean, I think the 1-2 punch of this one is it is more highly transmissible for reasons. Looking at the sequence of the virus, I can't really tell you why. Because to me, if you look at the nucleocapsid protein or the 681 position, which is the fear and cleavage site, it looks more like alpha than anything else. So I was surprised to learn it is so transmissible. It does seem to bind tighter to the host receptor because now you have some ionic interactions, ionic bridges forming where you didn't before. So maybe that has something to do with it. So I don't know the basis of its transmissibility, but of course, with those mutations in the spike protein, the antibodies to the spike protein that were made against the original lineage are not neutralizing as well the spike protein of the Omicron variant, hence the decreased efficacy and the decreased levels of virus neutralization. So what do you do about it? Well, I've made one suggestion. Absolutely nobody seems to like it, which is that to keep the healthcare workforce, think about a second boost, a fourth immunization, and for the healthcare providers. And the reason I say that, when you look at the vaccine efficacy versus Omicron, it's about 70-75%. But that's best case scenario. Some modeling data from Imperial College London says it goes down to 30-40% a couple of months out after the boost. So it wanes pretty quickly. So the durability of the mRNA vaccines, or at least the Pfizer vaccine, may not be as strong as we'd hope. I've been saying for a long time, probably even on Hood Med Chat, that it's not going to be one and done and two and done. It'll be three and done. And I felt pretty confident of that. So I was a bit shaken when I saw how quickly the virus neutralizing antibodies went down against Omicron. Is that something unique to Omicron, or are we learning something new about the mRNA technology that we didn't know about before? So I don't know. And in the long run, I'm not sure what we do about it. But from the short term, should we give a second boost to the healthcare providers to keep them in the workforce so they don't get breakthrough COVID? And so I put it out there, but so far I'm not getting much traction. Interestingly, the Israeli government came up with the same idea. So they are recommending that, or I think they're at least talking about it as a second boost for the healthcare providers. They also added on those over the age of either 60 or 70 as well. And now I understand why with that decline of virus neutralizing antibody.
Cameron Casey asks a question that many of us are pondering. Do we think this virus will mutate indefinitely and possibly get even worse?
Well, the answer is yes. If we refuse to vaccinate the southern hemisphere, Mother Nature's already told us she has that in mind for us, right? She allowed Delta to arise out of an unvaccinated population in India earlier this year. She allowed Omicron to arise among an unvaccinated population in southern Africa just now, and that's the plan, right? Until we vaccinate the world, we're going to be doing this. I mean, in some ways, we may have gotten lucky. Omicron,
Yes.
not unlucky in the sense that Omicron is more transmissible, but a little bit lucky. Maybe it's not producing more severe disease. But what if she comes along and gives us Omicron revved up and causing more severe illness? Then we're in crisis mode, a real crisis mode again, even more than we are now. So that's why our vaccine, I hope, will come along. We can vaccinate the African continent, Indian subcontinent, and Latin America to stop this once and for all. And it's amazing that the global leaders really haven't figured this out. We should have learned our lesson after Delta, but now hopefully with Omicron maybe. But we're still now with our collaboration with Biological E and our partnership to produce this recombinant protein vaccine. They've got now 150 million doses ready to roll. They're going to rev it up to another 100 million doses a month, a billion doses. And that's great, but the truth is we're now exceeding the global commitment of the United States government. So it's, on the one hand, it's great that a small research institute out of Texas can do this. On the other hand, it shouldn't be that we're out pacing the U.S., the entirety of the United States government in this regard, and much better than each of the European countries. So it's a reminder that they really do have to step up.
Yeah. So in regards to that, I just dropped the link for everyone on Corbavax, your vaccine that your group developed. Um, and I guess everyone's mind is like, where does that responsibility lie? I know you've talked on here a lot before about, the current administration and how you've worked to try to, promote global vaccination. And I guess where we are now, a lot of people in the chat have been asking, what can the average citizen do? Like, what can we do to help? And because it's like obviously something that's going to have to come from like a groundswell of like sort of like that societal moral like compulsion that we need to do this, right?
Well, I mean, certainly here at home, if you have friends and colleagues and relatives who are not getting vaccinated, tell them to get vaccinated. If you've got friends and colleagues who've gotten 2 doses but not gotten their booster, get them boosted because they're going to need it for this Omicron variant. If you've got friends and colleagues who think just by being infected and recovered, they don't need to get vaccinated, remind them that a lot of the Omicron infections in South Africa and the UK are in fact reinfected, and remind them to vaccinate their kids. So vaccinate, 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 and vaccinate. And then if you have the time after that and you're not too exhausted, contact your a representative in the U.S. Congress and see what the Biden administration can do to step up their game. I mean, and the U.S. really does have to take leadership in this. You might say it's not fair that it always depends on the U.S., but that's life in the big city. We need U.S. leadership to really take this on.
Yeah. So I guess in terms of some of the other questions that we've had about Omicron, we saw this week a warning that the home test kits may not be as sensitive to Omicron now. How does that, and also sort of what you were saying earlier about the impact to the vaccine effectiveness, how does that kind of come into play if the testing might be compromised, I guess?
Well, the testing, we've never really fixed testing in this country. And now you've got the president, going to buy 500 million kits and get it out there. I hope it still holds up well against Omicron. I think the bigger problem is getting agreement on how to use those tests, because the CDC has now decreased the quarantine period and the isolation period to 5 days. And many of us feel that they should be followed up by a test to confirm that they're negative. And then the question is, what does that mean if there's a problem with Omicron sensitivity? Right now, the CDC is saying don't test, in part because they don't have the kits to mandate it or to recommend it. But when that comes online, I'm trying to figure out a way to move forward and do testing after 5 days. And then you're hearing some mixed messages from the White House and CDC saying, well, the tests may not have great positive predictive value anyway. Well, don't tell us that and then tell us you're ordering 500 million of those guys on top of it. So try to, be more consistent in your messaging.
Yeah. Sorry, we're having some screen freezing issues, so I'll take the next question. But
am I freezing or
no? I think
no, it's on my end.
It's I think Doug, you were going to ask about the CDC. Are you frozen too?
Yes. No. So there were, as you know, the CDC released new guidelines this week for recommended isolation and quarantine. And there were a lot of questions about that. Could you give us some clarity in your thoughts on this announcement?
Well, I started that discussion in the last question, but I think what you're seeing is trying a balance of trying to know the best in the science with the reality of trying to keep the country operating and keep our essential services going. So by having people leave the workforce for 10 days, especially if you're an essential worker, I think that's going to be asking for trouble. We're just going to have too many people out. Now, the CDC is saying no. We're not really doing that just for to keep people in the workforce. That's what the science says. The science though is a little bit murky, in part because the science is all based on mostly on previous lineages. We haven't had the time to really look at it for Omicron. I think that's one issue. I think the other is how you actually are measuring true shedding of virus to cause transmissibility. That's another issue because by PCR, you could be PCR positive for days or weeks after having an infection, but you're not actually shedding virus. So how do you actually determine that you're shedding virus? So those studies are more limited in scope and number. And then so the current thinking is that you're shedding virus maybe a couple of days before you're symptomatic and a couple of days after that. More if you're vaccinated, fewer days if you're vaccinated. So I think that based on that, that's where the 5-day period came up with. But if you really look at the actual numbers, it's probably like a Poisson distribution. There's probably a number of people who are only shedding virus for a couple of days, and there's probably people that are shedding a lot of virus for weeks. And so where you cut that off could be a bit of a judgment call. And as I said, the only real data that I've seen other than recovering virus in terms of epidemiologic studies and contact tracing studies were early on in the pandemic from Wuhan, where they found about 6 days was about the right period where people were really shedding virus enough to transmit it from one to the other. But is that the same with Omicron, or is it worse? I don't think we really know that yet. So again, I think it's a matter of trying to, and it's a little frustrating that we've not been studying this more rigorously at the CDC. So I think it's a balance between bits and pieces of the science with the reality of how we keep the country going.
Absolutely.
And if I just confused you, and if I sound confused, that's because I am. I think everybody is to some extent.
Yeah, I think we all agree with that. There's so much nuance involved in the new CDC guidelines that, in some sense, it's a little dangerous for the average person because they may just completely ignore it because they don't understand what's going on. We have a question from Abby about mild cases, and it's something that we've highlighted a lot in the past couple of weeks. Abby asks, I can't get a good handle on how many mild and or asymptomatic cases, especially vaxxed and mild, lead to long COVID or long-term / permanent negative outcomes, like organ damage that isn't necessarily a signature quote unquote wow sick COVID symptom or concern. And she'd love to have more info about that. I guess what she's asking is some people are developing long-term symptoms that aren't really something they see with people who actually have COVID. What's the concern for people who are mildly affected by COVID to develop some things like that?
Well, first of all, there's a lot of different definitions of long COVID, which adds to the confusion. And then when you talk about long COVID, are you talking about mostly cardiopulmonary symptoms, shortness of breath, and heart palpitations? Or the most concerning one that I see is cognitive decline and gray matter brain degeneration that we've seen from the UK study, and we've talked about that. How that correlates with severity is still up for study. Some feel that it's that long COVID is more common with serious cases, and that may make some sense. And it may in part be around the mechanism. So we're learning more about the mechanism of long COVID in terms of autoantibodies or microglial activation. So it seems to be more of a host inflammatory response to the virus rather than the virus itself. Having said that, now there's recently been some new studies showing that there is persistence of virus in the body, not so much the brain. So that may be another factor in this. So exactly, predicting who's going to go on to develop long COVID, I think we still don't really have a good handle on it, at least based on variants. There seems to be some association with being a woman more than a man in terms of long COVID. Age cutoffs, comorbidities have something to do with it, but there's no absolute criteria for knowing when someone's going to get long COVID. And we're even seeing it in some kids. So the Great Ormond Street Hospital in London, the big children's hospital, has done a study showing that 1 in 7 of the kids can get long COVID as well. So that gives me pause for concern when we're opening up the schools. Everyone is tossing this off as a mild illness, but what are we doing to do all the neurodevelopmental monitoring of all of these kids if they get COVID in the schools, which they will if we start opening schools in Washington and New York now, and how do we manage that? So I think as a country, we need to put, like so many things that we come up small with in our health system, I think this is one of them, not really putting in place how we're going to monitor all the neurodevelopmental issues of long COVID, because those are the ones I'm most concerned about.
Yeah, and a note about mild COVID. I think we've seen the term thrown around a lot recently, and some people have kind of mocked it. And I want to give a shout out to one of our Twitter followers, Amani Cushion. This isn't salsa. This isn't choosing a level of heat. Mild COVID is still COVID. We need people to understand that. Dr. Hotez, you may or may not know, I'm actually still in isolation as I developed COVID symptoms about 5 or 6 days ago. And I can tell everybody who's listening, they were very mild. Thankfully, I didn't have to be hospitalized. My oxygen levels never dropped below 97%. I didn't have significant trouble breathing. But this mild version of COVID wasn't fun at all. I had pain all over my body. I was freezing inside of a hot shower, sweating, chills. It was horrible. So I just want to warn people out there, mild COVID is still COVID, and COVID is a very destructive disease on our body. And I think the worst part of it all is that I've been isolated from my family for almost the past week now. I can't hug my kids. It's something that's, devastated them as well. So we have to continue to be careful and be vigilant out there.
Yeah, and remember, we're talking about this virus sweeping through the country. 300,000 cases today, new cases today, and you have to multiply that probably by a factor of 4 or 5. We've seen all the pandemic, so you're talking well over 1 million new cases today. And so this is happening over and over and over again in the country, and that is going to take its toll. So I think just saying, hey, it's a mild illness, I think is not fair to anybody. And we are seeing serious breakthrough cases even among those who are vaccinated, even among some who are boosted. Over the weekend, I had 2 close physician colleagues who had breakthrough COVID and required hospitalization, even though they were vaccinated. But what happened was they were vaccinated, they got their booster a while ago, and you are seeing that waning immunity pretty quickly. So hence my rationale for the second immunization. So Omicron is really, in many ways, the most challenging of all.
Yeah, we've all seen your comments on this anticipated holiday surge. With a lot of people disregarding the warnings to enjoy what was probably a very Merry Christmas for Omicron. Right? We have New Year celebrations that have been canceled the world over this weekend. What are your thoughts, and how would you advise people leading up to this New Year's weekend?
Well, I'm going to be forever known as the killer of fun in America. So I've already given up all hope otherwise. And I know people are going to see me 2 years from now and still get PTSD. So I might as well just let it rip. I don't get together with big groups on New Year's Eve. I mean, Tony Fauci, I think yesterday or today said, don't plan on, if you plan on a 40 or 50 person gathering on New Year's Eve, and drinking alcohol and everything else, forget it. There's just going to be too much COVID transmission. So, we're keeping sort of a small family gathering, and everybody's been fully vaccinated, and I would just say, look, hopefully this Omicron wave passes almost as quickly as it started, and if it's fun for you, go plan a big New Year's event on March 1st, and make that your priority rather than trying to put a square peg in a round hole, trying to do something reckless on New Year's Eve.
Yeah.
And maybe about 4% of the country will listen to me.
Right.
Yeah.
It's going to be, I don't know. I mean, hopefully with everyone canceling their like ball drop celebrations and stuff, people will like take that to heart.
And it's heart. I don't want to say heartbreaking. That's too strong a word, but it is demoralizing, right? Everyone's exhausted. They've been through 2 years of this stuff, and I think there was some hope, that if Omicron were delayed, we would have had a pretty fun New Year's Eve and a fun Christmas, and there's no question this has put a damper on it. But hopefully we'll get on the other side of this wave, and then we can figure out next steps.
Yeah, I just hope people understand that, as you said earlier, it sucks that Omicron is so much transmissible, but we're lucky that it's not more lethal, and the next one that we get could be. So we got to be extremely careful out there.
Well, again, this is why we have to vaccinate the world, because we did get lucky in that sense. I mean, can you imagine if it was, as transmissible as Omicron, but something as bad as, Delta or the previous variant? And that could easily happen, right? So then that's going to create a lot of panic. And then I guarantee you our health system will collapse.
Entirely. But to leave on a light note, why don't you tell us what you're looking forward to in the new year as far as like Corbavax and your work? What are your projects that you're looking at going into the new year?
Well, I'm hoping to expand. The BioE is now scaling up production, so they're going to every month 100 million doses, so getting the world vaccinated. But we've also licensed it and helping in the production, co-development with Indonesia and Bangladesh, and now a new venture in Botswana, so Immunity Bio, which is headed by Patrick Sung-Shung, who a wealthy biotech guy in LA, who's owner of the LA Times, has now made this commitment to build vaccine development capacity in Botswana. So that would be amazing if we could, do something there. And so that's one of the things I'm looking for. So trying to scale up. I'd love to get some help from the Biden administration in that. Love to get some help in getting this vaccine into the U.S. because I think a lot of parents would be willing to vaccinate their kids with our vaccine because it's the same technology as the hepatitis B vaccine that they've been giving to their kids for decades. So they've already accepted the technology. So it might not be such a leap. That would be great as well. I've started discussions with Johns Hopkins University Press on a new book looking at this whole authoritarian anti-science monster coming out of political extremism on the right. This will be an interesting book because it'll force me to learn some political science. And so I'm excited about that. So those are the big picture things. So.
I'm sure we'll rope you into something as well.
Yeah, absolutely. I think we all want to congratulate you guys for the launch of this vaccine. I think, there's so much good that will come out of this. And I want to applaud you all. I think I read that you guys decided not to patent the vaccine for hope that it will help in the distribution of it globally. And that your hope is to get up to 300 million doses a day as well. So,
300 million doses by first quarter next year.
Yes.
Then BioE has the capacity to make 1 billion doses, and then if we could do the same with the other countries. So that's the big push, is trying to finally vaccinate our way out of this pandemic. And everyone says it's not possible now, and partly because it's not going to be possible with mRNA and no virus vectored vaccines. They can't be scaled to that level, but I think that you can with ours.
Yeah, congratulations. Anything we can do to help push that, you let us know.
Absolutely. No, look, I appreciate you giving me a voice here, and and you've been such good friends and colleagues through this whole pandemic, and I look forward to continuing the discussion. I hope next time around maybe we're on the other side of this curve and we can have some real happy talk rather than the fake happy talk.
Yeah.
Well, thank you, Dr. Hotez, for joining us today. We know your time is so thin. You're out there everywhere trying to help save our lives and keep us informed about what's going on.
Well, the hard part is I'm losing my voice. I'm so talked out. So,
Well, thank you so much for coming and joining us today. We really appreciate it.
I got to rest up a little bit for CNN this afternoon.
Right?
Yes. Hot tea with some lemon is always.
Is that what the doctor prescribes?
Hot tea with some lemon. That always helps.
I'm going for it now.
Yeah, absolutely.
Well, God bless everybody, and thank you again for all your great stuff.
Thank you.
Thank you.
At Hood Medicine, we want to bring you guys trusted individuals like Dr. Hotez to provide you with the facts and information to allow you to make the decisions necessary to keep you and your family safe. Please follow us on Facebook, Instagram, Twitter, and LinkedIn as well to support our efforts. Thank you so much for joining us. Please keep safe, and God bless you all. Take care.